Hello and welcome to the 1-800-RESPECT webinar, Trauma-Informed Digital Design, applying the practice guidelines for trauma-informed care and service delivery to the digital space. Thank you for joining us. Our webinar today is being presented on the traditional lands of the Eora Nation and the Kulin Nation, and we wish to acknowledge them as traditional owners. We would also like to pay our respects to their elders, past and present, and the elders from other communities who may be present today. 1-800-RESPECT is a confidential information, referral and counselling service that is open 24 hours a day, every day of the year, to support people impacted by sexual assault, domestic or family violence and abuse. People can access the service by phoning 1-800-737-732 or visiting 1800respect.org.au. Today's 1-800-RESPECT webinar will provide an overview of Blue Knot Foundation's nationally and internationally acclaimed practice guidelines for treatment of complex trauma and trauma-informed care and service delivery. It will focus on the trauma-informed guidelines for services and their workforces, the philosophy and vision behind them, their core principles and the process of mapping them to practice for services and systems. The Blue Knot Foundation's trauma-informed guidelines were recently adopted with a digital lens to guide the 1-800-RESPECT website redevelopment. This webinar will present the approach to applying these guidelines to a digital setting and the key learnings from the process. Please note that this webinar is live and interactive, and we will try to answer as many of your questions at the end of the presentation as possible. We are now pleased to welcome our presenters, Dr. Cathy Kezelman, the President of the Blue Knot Foundation, and Kim Preston, Design Director from Tiger Spike, the organisation engaged to develop the 1-800-RESPECT website. A very warm welcome to you both. It is now my pleasure to hand over to Dr. Kezelman to start the presentation.
Thank you for that, and thank you for inviting me here today. I'll just move over those unapologetic plugs to the slide about our practice guidelines, and we're very, very excited that these guidelines have now been adopted and translated into the digital space. They're informed by 20 years of research around trauma, and within the guidelines there are two sets of guidelines, as you can see here, one around the treatment of complex trauma, and one which will be the focus of today's webinar around trauma-informed care and service delivery. But just a little bit of background, I need to make an important distinction, and that is to differentiate single incident trauma, or PTSD, such as is experienced in a car accident, a natural disaster, or a one-off assault in adulthood, from complex trauma, which is interpersonal, more prevalent, developmental, often repeated and often extreme, and its impacts are cumulative. The majority of clients who experience trauma-related problems have complex rather than single-incident trauma. So while these guidelines were more focused on the complex trauma of child abuse, child neglect and other adverse childhood experiences, they're highly applicable to people who've experienced domestic and family violence, another form of complex trauma, and sexual assault. So domestic and family violence and abuse, as well as sexual assault, impact millions of Australians, adults, mostly women, although not exclusively, and children, of course. People seeking help from 1-800-RESPECT have been traumatised and are living day to day with the impact of their trauma, past and current. They are often living in fear or experiencing ongoing impacts or acts of violence which severely compromise their physical and emotional safety. They've been betrayed, lost their sense of control, and felt disempowered. The trauma-informed guidelines are as relevant to work with people impacted by the interpersonal traumas of sexual assault and domestic and family violence as they are around childhood trauma. Their application to the digital space highlights their universality and the diversity of settings to which they can be applied. Blue Knot Foundation is delighted that 1-800-RESPECT has applied these guidelines to the digital space, modelling a whole system approach to align with existing trauma-informed policy and service delivery. So I'm going to talk about these two different areas, philosophy and vision, which outlines the core principles which underlie and infuse service delivery to be trauma-informed, and mapping to practice, which considers implementation at systems and service levels. So when looking at philosophy and vision, we need to understand about trauma-informed care and what its essence is. It's about people's strengths. It's about respecting lived experience and the particular vulnerabilities and sensitivities of trauma survivors. It's about collaborating with people at the centre of their care, a process undertaken in the digital design process to develop a website which speaks directly to trauma survivors. Each of us is unique and we don't exist in isolation, but in the context of our family, community, needs and desires. A trauma-informed approach prioritises cultural safety and attunes to all sorts of diversity, be it around gender, ethnicity, sexual orientation, socioeconomic status, age and disability. Trauma-informed practice acknowledges the prevalence and the impacts of lived experience and the uniqueness of each person's responses to their trauma. It attends to the diversity of those responses and the diversity of people's needs and of the services to which people present to have those needs met. That's why it's important for services to develop a shared trauma-informed language so they can be coordinated, as is again honoured in the inclusion of a service overview in the 1-800-RESPECT website. Why is all this so important? It's because many people have experienced additional trauma when seeking care and support in the past. They've been re-traumatised rather than being assisted on their road to recovery. And as service providers and fellow citizens, we need to minimise those risks. So a service charter, what does a service charter achieve? Because it doesn't sound overly exciting in itself, but it's really critical because what it does is it enables us to outline and record the principles we need to embody and enact to underpin our services and our systems so we can engage in the major shifts often that are needed to minimise re-traumatisation and promote recovery. What does this major shift entail? It means a service which works with people rather than one which is hierarchical, in which the service and its providers are the experts. Instead of working with people, it does to them. Being trauma-informed means moving from an illness symptoms-based model to one which helps people identify their strengths, garner resources and acquire skills to build on their strengths. It helps us move from a pathologizing approach which asks, what's wrong with you, to one which is basically an orientation of blame, to one which is of understanding, which asks the question, what happened to you? It means moving from a caretaking, paternalistic stance to one which is truly collaborative, recovery-oriented, and minimises re-traumatisation. We know that people can and do recover from trauma. All aspects of our services need to embody that message of hope, recovery, and possibility. The tone of the 1-800-RESPECT website has reflected this and is positive and hopeful without being condescending. So, in mapping to practice, how do we implement philosophy and vision of trauma-informed care? So we know that integration is one of the processes of trauma recovery, integration of the body, mind and emotions, which trauma disrupts. The same process is reflected in implementing the philosophy and vision of trauma-informed care. Human challenges are interrelated, as are the efforts to resolve them. So too are systems. What affects one part of the system affects the other. A trauma-informed approach is a holistic one which considers the system as a whole, including the implementation and effectiveness of services within that system. This means that policies, procedures need to be reformulated to respect trauma-informed principles and diverse coping mechanisms, as well as diversity. While mapping to practice distinguishes between system level and service level, there are areas of overlap and an interconnectivity which underpins them both. So looking at mapping to practice, when we're looking at a systems level, and just, this is a very quick overview. There's a lot more detail that needs to be drilled into. Currently, systems often work in silos. The reality is that people's trauma responses and needs do not exist in silos. Trauma survivors often have many different challenges affecting different parts of their lives at different times. Care which empowers healing needs to be coordinated across systems, and diverse services need to collaborate to deliver that care. While people who have experienced interpersonal violence have had their rights violated, a trauma-informed system upholds their right to effective trauma treatment, their right to freedom from re-traumatization, and the right to freedom from further harm. Trauma-informed change necessitates top-to-bottom and bottom-up training, regardless of level or role, including basic education around personal and professional boundaries, with respectful engagement and sensitivity of all interactions with all clients and staff at all times. This means assessment of individual and collective performance around their trauma sensitivity, minimising re-traumatisation, the risk of vicarious traumatisation for staff, and promoting ethical conduct. And now just a quick discussion around the service level. Trauma-informed change in services necessitates a cultural change and a process of ongoing self-monitoring and quality assurance. This begins by identifying all the services, activities and settings, the sequence of services through which clients move, that is the whole client journey, as reflected in the digital adoption by 1-800-RESPECT, the staff who are in contact with clients at each point, and the different settings in which activities occur. This entails asking key questions about each of these activities and settings. How do they currently operate, and how might they operate differently according to principles which are trauma-informed? It's then important to consider our goals and begin to prioritise them. Which goals are most likely to be accomplished? Which goals are well-resourced and best supported? Which goals will have the most impact, not just on services, but of course on outcomes for clients? Which practices need to be changed because of their negative impact? Then it's a matter of establishing the objectives, setting outcomes and timelines, and of course finding the right people to make it happen and to monitor the process to make sure that it keeps happening. So in mapping to practice, we need to consider 5 domains, and these are the core foundational trauma-informed principles. Domain of safety, physical and emotional safety, and of course many people who've experienced trauma have never felt safe. So to what extent do the activities and settings ensure clients' physical and emotional safety? How can services be modified to ensure this safety more effectively and consistently? Trustworthiness. People have often been profoundly betrayed in interpersonal relationships. So how do we maximise trustworthiness? By clarifying service delivery tasks, ensuring consistency in practice, and by maintaining suitable boundaries. How can services be modified to ensure that tasks and boundaries are established and maintained clearly and appropriately? How can the program maximise honesty and transparency? Choice. Some survivors have never experienced choice. They don't even know what it is they want and desire. To what extent do the program's activities and settings maximise clients' experiences of choice and a sense of control? Because when you're being traumatised, you can feel completely out of control. How can services be modified to ensure that client experiences of choice and control are maximised? Empowerment. Abuse and violence are about disempowerment. They're about power imbalances. So again, to what extent do activities and settings prioritise client empowerment and help them acquire skills both from internal and external resources? How can services be modified to ensure maximisation of experiences of empowerment and the development and enhancement of client skills? Obviously, policies need to reflect this. To what extent do the formal policies of the program reflect an understanding of trauma survivors, of their needs, of their strengths, of their challenges, and of course of staff needs? Are all these policies monitored and implemented consistently? And of course, screening for trauma, and that's an enormous area that, unfortunately we don't have time to explore today. But thank you so much for your time. I think it's time to hand over to Kim.
Thank you, Cathy. A trauma-informed design approach was new to Tiger Spike when we began the 1-800-RESPECT website. And to be honest, it was quite daunting. We had a lot to learn, not just about sexual assault and domestic family violence sector, but also about how trauma affects people and the way that they might engage with digital products. I recommend anyone begins by undertaking training with Blue Knot to get a good understanding of the effect of trauma on users, on your product or service, and I know that me and my team found it invaluable. In order to define our approach, we workshopped as a team and alongside 1-800-RESPECT and representatives from the sector how we might apply the guidelines of safety, collaboration, choice, trustworthiness, and empowerment to the website. And we used Blue Knot's example questions as a base for this, just repositioned to reflect the digital landscape rather than the physical environment. We then mapped these ideas against what we knew about the journey a person experiencing violence and abuse might undertake as they moved from contemplation to preparation, establishing safety and reconnection to ensure that we were applying these guidelines across the stages of change model that most of you will be more than familiar with. By doing so, we were determining that at different stages of a person's journey, different guidelines began to feel more relevant. For instance, we understood that when users are currently experiencing that they may be less interested in making decisions or collaborating, but more interested in feeling safe and being able to trust the service that they're engaging with. Most importantly, in any website or app development, and especially a trauma-informed one, we tested our collective ideas for the site with a broad range of users of the 1-800-RESPECT service, both in user interviews and in usability testing sessions, where we presented sketches and wireframes or outlines of the website that we were envisaging. Due to the sensitive nature of the subject matter and our desire to incorporate a trauma-informed approach across all stages of the product delivery, we developed the following guidelines for trauma-informed user engagement. We understood from taking the Blue Knot training that different people will feel more or less comfortable depending on where they sit in relation to the door or the exit, so we allowed people to choose. We avoided sitting or standing behind the participant, and we ensured that the environment in which we conducted our user engagement sessions were free from clutter, were calm, and were friendly. So we avoided using our meeting room that kind of looks like an interrogation room, and we would generally advise to avoid any rooms that are overly corporate or institutional. We ensured that participants knew that they could stop the session at any time and without needing to give any reason at all. We provided ample water and tissues within arm's reach. And we scheduled more time than we would on average to allow for breaks or disruptions and to ensure that we weren't hurrying people. We were really trying to cater to the needs of all of our audience members. It's important to note that telling stories can be therapeutic for some and re-traumatizing for others. And it may also be traumatizing for the interviewers. As we were not engaged in the specifics of the abuse, but rather the way that users might search for and find information, support, and services, we generally sought to avoid these stories. In the instances where they were raised, we obviously sought to listen and provide whatever support that we could. 1-800-RESPECT were excellent in their approach to our user engagement sessions, ensuring that all participants had access to their service afterwards and following up a day or so after just to check in. Perhaps obviously you want to explain the nature of the research, how and why it will be conducted, and how the participants' responses will be used. You should allow participants to choose the types of recordings that they're most comfortable with as well. We gave the choice of screen interactions when we were testing, people interacting with prototypes that we had created, recording their audio or voice, recording video, taking photography, or just simple note-taking, and we were prepared for all of those. Interviewers should avoid making any assumptions about or on behalf of the participants. And of course, you need to ensure that you are present, that you are actively listening, and not just trying to check off a predetermined list of questions. And finally, you need to make sure that the participant feels heard. I would also suggest that you shouldn't be afraid to show sympathy to your users. User engagement sessions can often feel really clinical as you're trying not to sway the users' responses, but for this engagement in particular, it just didn't feel appropriate to maintain that same level of distance. In the spirit of a universal assumption of inclusion that all consumers may be in trauma, we have established these user engagement guidelines now into all of our user interviews and usability testings that we perform at Tiger Spike. And that is something that's really key to me. What we found is that when you're applying these guidelines, what you're really doing is delivering a best practice, human-centered design. At Tiger Spike, we were already doing a great job in understanding how to create an accessible 1-800-RESPECT website for users with disabilities or special needs. And our design process meant that we already were considering how age or gender, ethnicity, culture, literacy and remoteness might affect the user's experience of the 1-800-RESPECT service. But by applying this trauma lens as well, we're actually going that one step further to imagine a truly human-centered and user-friendly digital product. I'd argue that these guidelines really should be applied across any digital product or service, but especially those within health, education, finance, and government sectors. Basically, if your audience is people, then your service should be trauma-informed. So how did we apply a trauma-informed lens to 1-800-RESPECT other than a trauma-informed user engagement? Here are some of the general changes that we made. We recommended that the content be rewritten to the reading level of a 12-year-old. We learnt that when people are experiencing trauma, even the brightest user may not have the cognitive capacity at that time to take in complex terms or large amounts of text. We also recommended that the tone of the content shift towards an unassuming one and generally be more inclusive, and for example, we removed gender pronouns where possible. We redesigned the page layouts with the aim of decreasing visual clutter, keeping content within a single column and increasing the white space throughout the site. By simplifying the site, our aim was to reduce the cognitive load for all of our users. We also suggested that the 1-800-RESPECT brand needed to be updated, not only for their colour palette to adhere to accessibility guidelines, but also to appear more calming, and that's why you'll see a lot more blue throughout the site. Photographic imagery in particular was updated to consider triggers and lend a warm, supportive tone to the site, while also trying to represent the diversity of the audience. This is something that we did a bit of user testing on, and it was really interesting to test our assumptions here. For instance, I had thought that imagery of beautiful landscapes, perhaps at sunset, would prove therapeutic. But our users suggested the setting sun made the trees look like they were on fire, and that the imagery we had chosen was traumatizing. Knowing that domestic family violence has been shown to increase during natural disasters such as bushfires, we obviously chose to avoid those scenes. So these are some more specific examples of how we align to the guidelines themselves. So under the banner of safety, we had areas of the site that previously required a user's email address and a password. Those were updated so that our users could preserve their anonymity. The quick exit functionality on the website was also improved, and we ensured that we were disabling autoplay on video and audio files, and that we were just thinking generally that the people who might be accessing this website may not want anyone else to know that they're accessing it. In terms of trustworthiness, given that 1-800-RESPECT is delivered by Medibank Health Services and the DSS, it might be surprising not to see government and institutional logos plastered all across the site. But these were removed in order to increase the trustworthiness of the site, particularly for users for whom government and institutions have unfortunately been the source of traumatizing experiences. The 1-800-RESPECT brand font was also updated to remove the serifs, which are those little dangly bits around the T and the R, for those who are not familiar. These are generally associated with institutions, and they can also make text a little bit more difficult to read. The new font, which is the sans serif version of the previous one, is much easier to read, and we increased the font sizes overall across the site, making it easier to read but also easier to scan. This is helpful given that people experiencing trauma are not necessarily reading large chunks of text, they're scanning for information that can help them right now. In terms of choice, 1-800-RESPECT provides a number of options for support, including live chat, obviously calling in, or information gathering and capacity building throughout the site. We learned that when people are in trauma, they prefer not to be asked too many questions. So while a conversational tone is quite popular in websites now, we avoided asking about questions of our users here. We also simplified the process of downloading content for offline viewing and made that easier to read as well. And we sought to limit the number of navigation options in order to reduce complexity and cognitive load. For a site like 1-800-RESPECT, which caters for so many different types of users at so many different stages of the journey, this was particularly difficult. In terms of collaboration, obviously we collaborated with users by engaging them in the product design and testing, and we continue to do so. We also ensured that we were not pushing users towards any one action, not suggesting that they call 1-800-RESPECT now, knowing that they may not be comfortable or even able to do that at the moment. A feedback form was provided for users to comment on the servers, and a survey has been running since the website launched to collect people's experiences so that we can continue to improve the site for everyone. For empowerment, we use next steps to provide users with more information when they are ready, and we surfaced information in a different way. Whereas previously information had been repeated for ATSI audiences, people with disabilities, support people, we simplified the content structure and the content so that users could self-identify more readily, and that also taps into the intersectionality of the people. Really, so what we were attempting here was to really empower users to dip into the site throughout their journey to find the information that they needed at that particular point. The website is not perfect, and we continue to work with 1-800-RESPECT and users of the service to improve all the time. But I really hope that it has made the experience just a little bit easier, a little clearer, and helped to connect people experiencing violence and abuse with the information and the support that they need. Okay, we'll be taking questions now.
Yeah, look, and I can see a question there for me, I think. The question is, how widely do you think the trauma-informed principles have been embedded into services? That's a really interesting question because it can be very hard to know, and as an organisation that really worked with others to get a national agenda going around trauma-informed practice, we do hear about pockets where trauma-informed principles have been really well embedded within entire local health districts, for example, where there's been sort of major changes in some parts of the legal and justice sector. And I'm sure there are a lot of areas that we don't hear about. And certainly to see, trauma-informed principles being embedded in a digital process, in a marketing promotional process, is revolutionary. And so it does show how deeply the change is happening and how extensive it is becoming. It'd be great to have it uniform so we really can have that shared language, but it's great to see the change.
Okay, I've got a question here whether I think that all websites should consider the guidelines or just those delivering domestic violence services. No, I believe that all websites should consider incorporating trauma-informed guidelines and practice throughout their design and delivery. I think when you consider the amount of people that may experience a traumatic episode in their lives, I think it's imperative that we begin to make all of our products and services more trauma-informed.
Yeah, I mean, I'd just add to that. I think, our organisation really would like to see a trauma-informed world because when you look at the prevalence of different sorts of trauma, past and present, we all have a lived experience of, traumatic stress along the way and how it impacts us and the way we go through the world and how we engage with, diverse services. So, this is a way of treating each other as human beings to try and understand where people come from and not judge them and not dismiss them out of hand and try and understand if they are seeming unreasonable or being triggered, that they probably have a reason in their past that's doing that. So I can't stress too strongly how critical I think these guidelines are and those principles. Just looking here. There's a question here, what buy-in and commitment have you got to these guidelines at federal and state level, public service and politicians? Look, I think it's an interesting one that the Royal Commission into Institutional Responses to Child Sexual Abuse has played a part in putting not just our trauma-informed guidelines on the map, but trauma-informed principles in general. And, they've made a very strong recommendation around that. And we are certainly seeing that the language of trauma-informed change is being used both at federal government, health certainly, DSS, as well as state government levels. So it is starting to become embedded. A number of years ago we saw recovery orientation embedded as an approach. It'd be great to see, trauma-informed practice aligned with that, because you can't have recovery orientation if you're not trauma-informed. So rather than seeing it as, something that needs to be cobbled on as yet another paradigm, to see how we can integrate these approaches, to really make a difference for all human beings seeking support and care.
Yeah, I agree. There's a number of questions asking if there's another one, if the role of government, what the role of government in embedding trauma-informed practice design for all services would be. And I think we already have a model for this. When designing websites and applications for government or services such as 1-800-RESPECT that are designed for all Australians, there are already guidelines for accessibility, such as the WCAG AA guidelines, and that's something that you must pass in order to produce a website for government. And I think we could add to that list a trauma-informed approach as well. And I think that the Digital Transformation Agency, which we needed to work with while we were delivering the 1-800-RESPECT website, would be the best place to start pushing for that kind of change. There was another question here around how we approached and selected people to participate in user testing, given that they're vulnerable and in a place of trauma. At TigerSpike, we didn't actually engage the users ourselves. 1-800-RESPECT did that work for us through contacts that they had. So they obviously went out and found people who were at a place where they were able to talk about their experiences engaging with the 1-800-RESPECT service, and they vetted them quite heavily to hopefully make sure that they would not be re-triggered by the experience of talking to us. That is definitely very tricky.
Do you have any suggestions about how to engage policymakers in organisations around trauma-informed training? And I mean, that's a very critical issue, that if you don't have buy-in from leaders and people who, to be crude, hold the purse strings, it can be very challenging. And training, a part of the organisation, when staff then go back to an organisation that hasn't embraced the cultural change, can be incredibly problematic. It can be a very slow process of building trust, and gaining the support of and identifying trauma champions within an organisation, and then really trying to engage the policymakers and the leaders, because for trauma-informed change, it's not just about training frontline staff or managers. It's about training all levels of the organisation, plus undergoing a cultural change right through the organisation in terms of systems, policies and practice. And it's an iterative process, because there's often a turnover, there's a change in management. So, it's not a quick process. It's something that probably is best done in bite-sized chunks when there's a will, but it can certainly be built on and developed over time.
There's two questions here that are somewhat linked. Whether or not there are principles specific to trauma-informed content writing, and also if there are any resources or guidelines for developing your own digital products in a trauma-informed way. As we began this project, we realized that there were not many, if any, other websites that had been developed using trauma-informed principles. So we kind of had to write them ourselves as we went, and this webinar is my way of beginning to share some of the learnings that we came across. I guess you can always come and chat to us or through 1-800-RESPECT if there's any specific questions that you would like to know at this point, but that's definitely something that we'd like to continue working through. And for content, I think that the 1-800-RESPECT team developed some guidelines internally of how they would take these learnings and apply them to their own content. So perhaps just need to connect with them to get a better understanding of what those might be.
Kim, I can't see another question immediately from me. Kim, are you?
Are you seeing any resistance to the adoption of trauma-informed design principles in your work?
Any resistance to the adoption of the principles in general? Or yeah, I mean, certainly, to embed change, takes a long time, and there certainly can be quite a bit of resistance to change, and change management is a sensitive process. We all tend to revert to form when we're challenged, and we're all very comfortable in the status quo. And interestingly, today I was looking through the literature to try and find some really good sort of outcome measures, and I saw that in another question about how do we establish the benefit long-term of trauma-informed change. And there are bits of information out of the States, but there hasn't really been really good evaluation over time to show that iterative training at different levels, all of the organisational change system approaches, not only obviously benefit the staff, but then what is the longitudinal benefit for people attending those services. And that's obviously, that's a real gap and something that absolutely needs investment, because anecdotally we know that, trauma-informed practice is of benefit, to staff, to organisations, and, with reduction in symptoms and for staff, better staff, fewer sick days and better staff cohesion and teams working together in collaboration. But we don't have the hard data on that. And that's certainly something that's screaming out to be done.
Yeah, absolutely. I think it's one of those things that the more that it's implemented, the more that we'll learn and understand, how to evaluate it better. I've also got a question here for an organisation looking to implement trauma-informed guidelines in a digital product. There may be concern about the increased cost to do this. In my experience, is the time to design a trauma-informed digital product much greater than one that doesn't? So we have a particular way that we work at Tiger Spike where we sort of do a bit of research, then we ideate what we think that the solution might be, and then seek to define that before we're going into a build phase. That allows us to engage with users at a number of different points before we're going into build, and first by interviewing and then by testing our approach. Adding the trauma-informed guidelines did add a little bit of extra time, mainly for the team to upskill in this area. So we needed to upskill a lot within the sector of sexual assault and domestic family violence in the first place, but then also to understand more about trauma and those effects. So it was a little bit of extra time, maybe a couple of extra weeks to be able to engage with all of the right professionals, to be able to read a lot of content and to workshop and ideate exactly how we were going to implement that within our service. I believe that the benefits are quite clear and that we've developed something which is a lot more useful and user-friendly, and to be a little bit cliche, as long as we've helped one person, I think it's been quite successful. I guess also the website is accessible and it meets accessibility guidelines, and that generally also adds a little bit to the development costs of the website. But I believe that the more that you do, the less expensive it will become as you start to embed it throughout your team and everyone just begins to sort of understand those principles. And I've also got another question about telling us more about why those colours. Yeah, that's interesting. Obviously we needed to stick somewhat to the 1-800-RESPECT brand, but we wanted to push that a little further, and we did test many different colours, and it's not necessarily my personal preference, but I think it works very well for the audience, and remember it's very diverse. Across, ages and cultural backgrounds, and it was just important that it was as calming as possible. So the 1-800-RESPECT logo, as you can see, is a bright orange colour, and that was a point of contention for many of the users that we spoke about, that it seemed quite aggressive. So we really just wanted to pull it down a little bit and make it calm and hopefully inoffensive. Oh, I'm sorry. It looks like we don't have time for any more questions. Is there anything else that you wanted to say, Cathy, before we say goodbye?
No, look, I think that's been great and nice working with you, Kim and Jennifer, so thank you.
Thank you.